Hello there and welcome to Daytime. I'm Cindy Edwards. We have a really fun show ahead and we're starting things off by taking care of ourselves. Every day there's a new study revealing the state of our health, and medical care is ever-changing. That's why it's so important to educate ourselves about what's new in the world of medicine. A lot of you have questions and we have experts with answers. We've got Dr. Carm Sebastian, Dr. Jill Hechtman, and Dr. Srinivas Iyengar, and they're joining us now to share their expertise with all of us. Good to have you all here.
Thank you for having us.
Happy New Year.
Yep. Happy New Year.
Here's to health and happiness for all of us. All right, we went to the streets. We got our viewer questions. Let's take a look at the first one.
I heard it's a pretty bad flu year this year, and I'm just wondering if I should be concerned and should get a flu shot, even though I think it's a little bit late to get one now.
Is it ever too late to get a flu shot?
No, I would say this is definitely one of the worst flu seasons on record. And if you haven't gotten your flu shot, definitely get vaccinated. It is really important that people are aware of this. And there's some certain populations that are more higher risk than others. And I think Jill has some information about that as well.
We can't forget pregnancy. That's already an immunocompromised state, so it's really important to get your flu shot in pregnancy. And remember, you're not only doing it for yourself, but you're giving the immunity to your baby, because they can't get the flu shot.
And it's not just the elderly and babies.
Right, absolutely. If you have any kind of chronic illness, asthma, coronary heart disease, you need to get it. And the flu season this year may go until May, so get it even if you haven't yet.
Oh, I'm stifling a sneeze right now. Hope I'm not getting anything. All right, we've got another question. Let's take a look.
Hi, I was just wondering if there is a good cure or management for muscle spasms in your back.
Oh, good question. But apart from a heating pad, what's the answer?
Well, actually, a heating pad was how I was trained. But there is new evidence now over the past 5 to 10 years that suggests that ice is the best way to go. You want to do that from 24 to 72 hours. Right when it happens, put the ice on 20 minutes on, 20 minutes off, and then you can go to heat, nice bubble bath, and that will relieve some of the spasm. And also, in addition, non-steroidals like Aleve, Motrin, if you can take them, are always helpful.
I know some people get addicted to pain pills really easily because of things like back spasms.
Absolutely. I mean, stretching and exercise are always important, so I believe in that.
Okay, let's move on to our next question right away and see what this person has to say.
I've been hearing a lot about blood clots lately. Is it something I should be worried about?
Yeah, Hillary Rodham Clinton just went through that. Who'd like to take the blood clot issue?
The blood clot issue is important because the fact is there's a lot of risk factors involved, smoking being one of them, potentially a family history. So I think that there's other issues involving hormone replacement therapy, and I'll let the ladies here discuss that a little bit about that.
Okay, blood clots aren't really that common, but they are common in certain people. Pregnant patients, women on hormone replacement therapy, people who have had recent surgery, and people who, let's say like a truck driver, who are stationary for a long period of time. So you can't always prevent having a blood clot, but little things that you can do are talk to your doctor before you get on hormones, obviously. And if you are someone who sits in a truck for hours or on an airplane for hours, get up every couple hours and move. That improves the circulation and can prevent a clot.
Is there a symptom that you can watch for? Like if you've hit your head like 3 days ago, is there anything that could happen?
Well, ordinarily, if you hit your head and you hit it severely enough, and we've seen this happen a lot, where people just don't go and get checked out. And you really want to, if there's any question, to get checked out. But what you'll normally see is a change in mental status. So people will get a little bit confused. They'll be very sleepy. That's why after a concussion, people, you know, your physician will always say to you, you know, wake them up every 20 minutes, etc. But the important thing, I think, that we're all trying to say is that most of blood clots that are problematic come from in the leg area, not in the head area. What she had was very unusual. But what we want to worry about is what Dr. Jill just talked about.
And remember, swelling, redness, and pain are the most common symptoms of getting a blood clot. So if you notice any of those, get right to the doctor.
All right, we've got another question for you.
Hi, I have a quick question. My daughter's 14 months, and the doctors force vaccinations on my child, and I've heard about autism, so I just want your opinion if it's okay not to give it to them and what's the side effects.
Oh, so many people are opting out of having vaccinations for their children.
That is really dangerous, and we all agree unanimously that vaccines for children and for others is very, very important. the autism issue was based on a study of 12 kids, 12 out of the entire population, who were just found to have symptoms of autism after they got the injection.
Right.
And so there's really no causal information. There's no empirical information that says that vaccines are bad. They have eradicated smallpox. They are eradicating polio. Get your kids vaccinated.
I think we both agree. Get
Absolutely.
the vaccinations. The risk of not getting the vaccinations way outweigh the risk of getting autism because of a vaccine, which has not been proven.
And you put all those other children at risk if your
Exactly,
child
exposure.
is not.
And again, there's a reason why polio isn't prevalent in the U.S. anymore.
That's right. All right, Dr. Jill, Dr. Carm, Dr. Iyengar, we're going to have you stick around, okay?
Thank you.
Yeah, coming up next, more health talk with our medical panel, so you don't want to miss it.